TNKase tenecteplase is indicated for use in the reduction of mortality associated with acute myocardial infarction, AMI. Treatment should be initiated as soon as possible after the onset of AMI symptoms. Contraindications. TNKase therapy in patients with AMI is contraindicated in the following situations because of an increased risk of bleeding. Active internal bleeding, history of cerebrovascular accident, intracranial or intraspinal surgery or trauma within 2 months, intracranial neoplasm, arteriovenous malformation, or aneurysm, known bleeding diathesis, and severe uncontrolled hypertension.
Dosing and administration of TNKase for acute myocardial infarction. The TNKase product kit contains everything needed to reconstitute and administer TNKase. The Becton Dickinson 10 ml Luralox syringe consists of a red hub cannula syringe filling device, twin pack shield, and a blunt plastic cannula. The TNKase kit also contains sterile water for injection USP and a package insert with full instructions. Aseptic technique should be used when dosing and administering TNKase, including thorough hand washing and the use of gloves when appropriate. Reconstitution. To begin reconstitution, remove the shield assembly and set it aside. Then insert the red hub cannula into the diluent vial and aseptically withdraw all 10 milliliters of sterile water for injection. Do not use bacteriostatic water for injection USP. Inject the entire contents of the syringe into the TNKase vial, directing the stream of diluent into the powder. You may see some foaming as you reconstitute. This is not unusual. If there are any large bubbles, let the product stand undisturbed to allow the bubbles to dissipate. Next, swirl the vial gently until the contents are completely dissolved. Do not shake the vial. The solution should then be colorless or pale yellow and transparent. Simple weight-tiered dosing. TNKase uses a simple weight-tiered dosing regimen of 5 broad increments. You can determine patient weight in several ways, depending on the circumstances. Weigh the patient to determine the correct dosing tier. Once the patient's weight has been determined, withdraw the appropriate volume of solution from the vial using the red hub cannula. The recommended dose should not exceed 50 milligrams. When the correct dose of TNKase has been withdrawn, recap the red hub cannula with the shield assembly. Before you administer TNKase, inspect the solution for particulate matter and discoloration. And, if you are using a line that contains dextrose, you'll need to flush that line with a saline solution before you administer TNKase. TNKase has no antibacterial preservatives, and it should be reconstituted immediately before use. If it is not used immediately, refrigerate the solution at 36 to 46 degrees Fahrenheit and use it within 8 hours. Administration. TNKase is now ready to be administered to your patient. A single bolus of TNKase should be injected over 5 seconds. Although the syringe supplied with TNKase is designed to be used with a needleless IV system, it is also compatible with a conventional needle. Instructions for administration of TNKase with split septum IV systems, Luralox systems, and conventional needles can be found in the product insert included in your TNKase kit. When administration of TNKase is complete, dispose of the syringe, cannula, and shield according to hospital protocol.
Warnings and precautions. Bleeding. The most common complication encountered during TNKase therapy is bleeding. Should serious bleeding not controlled by local pressure occur, any concomitant heparin or antiplatelet agents should be discontinued immediately and treated appropriately. All thrombolytic agents increase the risk of bleeding, including intracranial bleeding, and should be used only in eligible patients. Each patient being considered for therapy with TNKase should be carefully evaluated and anticipated benefits weighed against potential risks associated with therapy. Thromboembolism. The use of thrombolytics can increase the risk of thromboembolic events in patients with high likelihood of left heart thrombus, such as patients with mitral stenosis or atrial fibrillation. Cholesterol embolization. Cholesterol embolism has been reported rarely in patients treated with all types of thrombolytic agents. The true incidence is unknown. This serious condition, which can be lethal, is also associated with invasive vascular procedures and/or anticoagulant therapy. Arrhythmias. Coronary thrombolysis may result in arrhythmias associated with reperfusion. It is recommended that antiarrhythmic therapy for bradycardia and/or ventricular irritability be available when TNKase is administered. Use with percutaneous coronary intervention, PCI. In patients with large ST segment elevation myocardial infarction, physicians should choose either thrombolysis or PCI as the primary treatment strategy for reperfusion. Hypersensitivity. Hypersensitivity, including urticarial or anaphylactic reactions, have been reported after administration of TNKase. For example, anaphylaxis, angioedema, laryngeal edema, rash, and urticaria. Monitor patients treated with TNKase during and for several hours after infusion. If symptoms of hypersensitivity occur, appropriate therapy should be initiated. Adverse reaction. The most frequent adverse reaction associated with TNKase is bleeding.